Good morning, everyone. My topic of presentation is comparative study of 0.03% of tacrolimus eye ointment and 0.05% of cyclosporine eye drop in treatment of refractive cases of VKC. I have no financial interest. Introduction. VKC is common chronic bilateral recurrent inflammatory allergic disease of the ocular surface, commonly affect the boys, and male-female ratio is 2:1. Symptoms: itching, redness, photophobia, and foreign body sensation and lacrimation, resulting in visual disturbance. Conventionally, steroids are used for severe kind of allergic conjunctivitis, but chronic indiscriminate use of corticosteroid may lead to glaucoma, cataract, and secondary infection in the high steroid responder. Refractive cases are that show persistence of symptoms and signs despite of receiving topical 1% prednisolone acetate or use of systemic steroid treatment for more than 3 months, or cases in which there was relapse after tapering or withdrawal of the steroids. So now immunomodulator like tacrolimus and cyclosporine used in these cases. Subjects and method. This is the prospective clinical study done in 50 patients of refractive cases of VKC, in which 25 randomized to 0.03% eye ointment tacrolimus and 25 randomized to 0.05% cyclosporine eye drops. Aim of a study to compare the efficacy, tolerability, and safety of 0.03% of tacrolimus eye ointment and 0.05% cyclosporine eye drop in refractive cases of VKC. These are my inclusion and exclusion criteria. Methodology. All participants, guardian, or patient were provide written consent before the initiation of a study. The study protocol was approved by the Institutional Ethical Committee. All patients who satisfied inclusion and exclusion criteria at first visit complete general physical and ophthalmological examination like visual acuity, slit lamp examination, fundus examination, and IOP changes, IOP measured. Group 1 given eye drop, eye ointment tacrolimus 2 times a day, and group 2 given cyclosporine 4 times a day. Then follow-up done on 2 weeks, 6 weeks, 12 weeks, and 24 weeks, and evaluated for improvement in sign, improvement in subjective symptoms and sign, and any adverse effect in IOP changes. Scoring of symptoms and sign done by a scoring method in which maximum score of symptom is 9 and minimum is 0 as a total subjective symptom score and total objective sign score respectively. In total, subjective symptom score comprises only 3 parameters: itching, photophobia, and watering, where grade 0 comprises no symptoms and grade 3 is a severe form of the symptoms. Total objective sign score comprises 3 parameters: hyperemia, palpebral conjunctiva, hyperemia bulbar, and papilla. And again, grade 0 is comprises no sign, and grade 3 is severe form of the sign. Statistical method adopted for study were descriptive and statics and inferential statics. Results. Most of the VKC patients were 5 to 9 years of age group, and that is 56%, and 6% were above 15 years. Youngest patient in this study was 5-year-old, and the oldest one was 19-year-old. And in this study, 86% were males and 14% females. This is the changes showing the total subjective symptom score during treatment of tacrolimus and cyclosporine group on different visits, and both so on 4th visit 25% cases 100% cases so total subjective symptom score 0 in both the cases. This is table showing the total objective sign score in during treatment of tacrolimus and cyclosporine, and again tacrolimus group shows 100% improvement in sign after 4th visit, and cyclosporine shows 96% shows improvement of sign to 0 after the 4th visit. Discussion. In this study, 94% cases were between 5 to 15 years of age group, and VKC is more common in males, with male-female ratio is different study varying from 4:1 to 2:1. In this study, male-female ratio is 6.1 to 1. Tacrolimus eye ointment reduces the total subjective symptom score and total objective sign score 0 in 100% cases after 24 weeks of treatment in the refractive cases of VKC. While cyclosporine eye drop reduces the total subjective symptom score 0 in all cases, but total objective sign score 0 in 96% cases, while 4% cases have residual sign after 24 weeks of treatment in refractive cases of VKC. In this study period, IOP, lens, and fundus remain within normal limit. Only 1% of group 1 and 2% of group 2 reported mild irritation which subsided during the course of the treatment. Conclusion. Both drugs equally effective in resolving symptoms, and that is 100% and sign 100% by tacrolimus and 94% by cyclosporine in refractive cases of VKC at the end of 24 weeks of the study. Tolerability of the both drugs were good with negligible side effect. There were no evidence of IOP, fundus, and lens changes. These are my references. Thank you.
It was a nice study. So you gave a dose of cyclosporine 4 times a day?
Yes, ma'am.
Usually it is recommended twice a day.
0.05%.
Yes, you can give 4 times a day also,
Yes,
but
ma'am.
the irritation and the other symptoms might increase.
Yes, ma'am.
So it is known that tacrolimus is 100 times more potent than cyclosporin. So what did your study add to the literature?
Ma'am, we can use in refractive cases so that long-term side effect of a steroid can be escaped.
Okay, okay.
Actually, cyclosporin is also used these days in dry eye treatment as well.
Yes, ma'am. Yes,
So,
ma'am.
and most of the VKC cases also have dry eye also. What is your experience with this versus tacrolimus and cyclosporin? How do they affect dry eye associated with VKC in this case?
Sir, during treatment, it was improvement of watering symptoms. Patient have no, only few patients have irritations and blurring of vision in more in the tacrolimus group due to ointment maybe, and there is no any other symptoms like related to the dry eye I have experienced.
Thank you.
Thank you.